I use two measurements in my clinic to determine if the patient is at increased risk for chronic diseases such as diabetes, heart disease, high blood pressure, and insulin resistance. The two measurements are waist to hip ratio and waist to height ratio. These two measurements tell us if the patient has more belly fat and visceral fat, which is around the organs. Both of these require a measuring tape. Number one, waist to hip ratio. The waist circumference is measured around the narrowest part of the belly, whereas the hip circumference is measured around the widest part of the hip. WHO recommends a ratio of less than 0.8 in women and less than 0.95 for men. Higher the ratio, higher is the risk for obesity, metabolic syndrome, insulin resistance, and heart disease. Number two is your waist to height ratio. This is even better than your BMI and waist to hip ratio in predicting your cardiometabolic risk, visceral fat, and insulin resistance. As per WHO, the optimal ratio is less than 0.5. Ratio between 0.5 to 0.59 increases your risk of cardiac and metabolic disease. Ratio above 0.6 has the highest risk. As you can see, your tape is more reliable in predicting chronic diseases than your scale. I hope this video was useful to you. If you have any questions, please drop them in the comments below. And if you're in the Phoenix area, I'd love to help you.